How does the brain work? The brain is the most complex organ in our body and is the center for intelligence, emotion, memory, and basic functions that allow our body to work. The brain's complex network of 86 billion cells and around 175,000 kilometers of nerve fibers transmit information around our brain and body 24 hours a day, 7 days a week, enabling us to interpret and interact with the world around us. What is the blood-brain barrier? The brain is protected by the blood-brain barrier. This is a unique layer of micro blood vessels that act like a gatekeeper for the brain. The blood-brain barrier is very selective about what it lets in and out of the brain, protecting the brain against toxins and disease, and regulating nutrient supply to the brain. Although the blood-brain barrier is effective in protecting the brain, it's not perfect or impenetrable. In fact, there are several ways to cross the blood-brain barrier, including through its cells, between its cells, and within the cells of our body's natural defense system. Many lipid-soluble molecules can passively diffuse through the blood-brain barrier to enter the brain. Why do brain metastases happen? Sometimes cancer cells break away from their original tumor to a new area of the body, creating a new tumor. This is called metastasis. Breast cancer cells may spread to the bones, liver, lungs, or brain. Most cancer therapies can't cross the blood-brain barrier and so can't kill cancer cells in the brain. This is why the brain is often called a sanctuary site. For brain metastases to develop, the cancer cells modify their structure to allow them to pass through the blood-brain barrier and stay in the brain. Nearly 1 in 3 people with metastatic breast cancer may eventually develop brain metastases. This is more likely with some subtypes of breast cancer, but brain metastases can happen with any subtype. What are the symptoms of brain metastases? Brain metastases may grow to form one or several tumors. These tumors can create pressure on the brain and affect how it works, resulting in symptoms such as headaches, visual disturbances, brain fog, nausea and vomiting, seizures, or weakness or numbness on one side of the body, or issues with balance. These symptoms depend on where the tumors are in the brain. How are brain metastases diagnosed? In other organs, a biopsy is often used to confirm metastases, but in the brain, this would involve surgery. One way to help diagnose brain metastases without surgery is through brain imaging. A highly specialized team will discuss the best approach. If the metastases are small, then your doctor may wait before starting treatment. If you experience any symptoms that concern you, contact your doctor or nurse, who will be able to provide advice and may suggest further investigations. What does the future hold for brain metastases? As we get better at detecting and treating brain metastases, we're starting to see improvements in outcomes for people with breast cancer that has spread to the brain. If you have any concerns about brain metastases, please talk to your doctor or nurse.